Hello, welcome to the second Bariatric Surgery information session presented by the local specialist obesity service. This session contains a brief refresher on the types of weight loss surgery offered by the NHS, a more detailed look at pre- and post-surgery preparation, information about the risks associated with weight loss surgery in the short and long term, as well as the benefits. It also touches on some of the psychological impacts of surgery. Having worked with ELSOS for some time, you should have received nutrition education, either via the Eat Well course or with a dietitian. You should be making and maintaining changes to your eating and lifestyle. You should ideally have lost some weight and have done a trial of weight loss medication such as Orlistat. You should have been seen by our consultant physician in medical clinic. Once you have watched this session, please contact us using the form supplied. We will arrange an appointment for you to discuss the session and answer any questions. Please make a note of any questions and either send them in with your form or keep them safe for your next appointment. Following that appointment, we will book an appointment for a pre-surgery psychological review. The psychological assessment is a compulsory part of the weight loss surgery pathway. Please be aware that the psychological assessment may highlight areas of your life that need further exploration or support in order to achieve the best outcome from weight loss surgery. There are 4 types of weight loss surgery most commonly carried out on the NHS. Gastric bands are not regularly used as weight loss is not as great. Sleeve gastrectomy, single anastomosis or mini bypass, and gastric bypass are all performed. Your surgeon will discuss the most appropriate options for you. All these procedures can lead to significant weight loss. Around 48 to 68% of excess weight at 2 years. All have advantages and disadvantages. Detailed information about the types of surgery can be found in the first bariatric surgery education session, which is attached with this session. All types of weight loss surgery can produce rapid weight loss. Conditions such as type 2 diabetes, sleep apnea, hypertension, major joint pain, and fertility problems can improve and in some cases resolve. There may be a reduction in the amount of prescribed medication needed. There are some general considerations which affect all types of surgery. Currently, weight loss surgery is provided by a range of hospitals. Some may require further tests prior to surgery, such as a gastroscopy. The amount of time needed off work can vary greatly dependent upon which operation, wound healing, and the type of work you do. The minimum recommendation is 1 week, but ideally 2 weeks, as you will need to adapt to the liquid diet and may still be in some discomfort. Some people in more physically strenuous jobs may need more than 2 weeks and should liaise with HR as their work role may need to be temporarily altered. All types of weight loss surgery can increase fertility for both men and women, so appropriate contraception should be considered. Weight loss surgery may strengthen intimate and close relationships, but can further weaken a poor relationship. All surgery has the risk of complications including wound infections, vomiting, dehydration, and blood clots. Weight loss surgery requires the person to take vitamin and mineral supplements throughout their life to avoid deficiencies. NHS-funded weight loss surgery is designed to be a permanent procedure. It is not generally reversible. In this section, we will look at the liver shrinking diet required just before surgery, diet just after surgery, and long-term dietary recommendations. This picture shows the position of the liver, partly over the top of the stomach. Following a liver shrinking diet reduces the size and softens the liver, making it easier to move during surgery and increasing the chance of having a safe operation. If the liver is large, it is hard for the surgeon to gain access to the stomach underneath. This could result in changing to open surgery or cancelling the operation completely. Open surgery means a larger abdominal scar, which results in longer recovery and increased risks of complications. Each hospital has its own preferred liver shrinkage diet. These diets are very restrictive and cause the liver to reduce in size quickly. They are only to be followed for the 2 weeks just before surgery. Your surgery provider will answer questions about the practicalities of doing a liver shrinkage diet. Following on from your surgery, you will need to follow a strict texture-modified diet. This assists healing and stops the stomach pouch being stretched. During the first 2 weeks, only liquids are allowed, followed by small amounts of pureed food in weeks 3 to 6. From week 7, soft food that can be mashed with a fork are permitted, and many people are able to eat normal consistency foods from week 8. Your surgery provider will advise you on specific textures for you. For surgery to be successful in the long term, it is important that you keep to small portions. Otherwise, the pouch will stretch and the restriction which leads to feelings of fullness will be lost. Here is a suggested post-surgery portion on the right. Notice how much smaller it is than the standard portion. Eating from a smaller sized plate may help these meals appear more satisfying. Eating more slowly will also help. It's important to consider how you may feel as your portion is considerably smaller than everyone else's. This can be especially challenging when eating out or with favourite foods. Portion restriction is for every day of the year. There are no days off, holidays, or changes for celebrations. These dietary recommendations apply to all types of surgery. Eating small meals often is essential to get sufficient protein in the diet. Chewing food well avoids overfilling the pouch and reduces indigestion. It's important to stop eating when you feel satisfied rather than when you are full. At the point of fullness, the pouch begins to stretch. Avoid drinks before and after a meal, as the pouch can become full of fluid, leaving no room for protein and other nutrients. Successful post-surgery patients maintain their weight loss by increasing their exercise, most often by increasing their walking. Certain foods should be avoided. Soft, fatty foods, such as ice cream, chocolate and chips, are high in calories with little other nutritional value, easily consumed in large amounts, and can limit weight loss. Sweets and high-calorie liquids similarly can reduce weight loss and can cause dumping syndrome, which is explained later. Obstructive foods, such as white bread and tough meat, can be harder to swallow and get stuck in the pouch. Fizzy drinks can cause severe gastric discomfort and cause the pouch to stretch. They also offer no nutritional benefit. Alcohol, especially in the first 6 to 12 months, can cause dehydration, as well as being high in calories. Caffeine during the first 3 to 4 months can also cause dehydration. There are some possible long-term complications of weight loss surgery. Overeating can cause the pouch to leak, especially in the early post-surgery period, and may require further surgery. Vomiting and dehydration can occur if the eating and drinking little and often rules are not followed. Hair loss occurs if sufficient protein isn't eaten. Dumping syndrome, loose skin, and weight regain are discussed in more detail in the following slides. Dumping syndrome is caused when high sugar foods and drinks move into the intestines too quickly. This causes water to be drawn into the intestines very rapidly. This can lead to a drop in blood pressure, causing faintness and palpitations, sweating, nausea, and diarrhea. This can be minimized by avoiding high sugar foods such as sweets, cakes, desserts, and sugary drinks. Rapid weight loss can lead to loose skin. Loose skin can be particularly distressing, and skin folds can require a lot of care to prevent infections. It is most common around the abdomen, chest, buttocks, arms, and thighs. In general, the older you are, the less elastic your skin will be, making loose skin more likely. Smoking damages the skin structure, making renewal more difficult. Repeated weight loss and regain further stresses the skin and makes loose skin more likely. Increasing exercise to build muscle, eating a nutritionally balanced diet, and staying well hydrated can all improve skin health. The removal of excess skin by the NHS is very rare. You will have seen this slide in Bariatric Education Session 1. It shows how some weight is often regained over time following bariatric surgery. This graph shows the weight loss journey of 5 patients referred to our service after weight loss surgery. These patients had a variety of procedures in the past and were referred to us for further support. We don't know how prepared these patients were before surgery or how much support they had had, but you can see that they lost weight after surgery but regained most of that weight 6 years later. The aim of our service is to help you maintain your lifestyle changes so that at year 6 your weight loss is the same as at year 2 and you don't experience weight regain. Follow-on care after surgery is given by your surgery provider and is typically at 6 weeks, 3, 6, and 12 months, and finally at 2 years. After that, our service is commissioned to do an annual review of blood biochemistry and diet only. Our service is not funded for anything else, such as more in-depth dietary or psychological help if things are not going to plan. There is no guarantee that your mental health will improve following weight loss surgery. Surgery brings its own challenges. Eating with others, eating out, and social occasions all require planning. Relationships may change with a long-term focus on nutrition and exercise. Family and friends may need to become supportive in different ways, such as not offering unhelpful foods, changing the way they eat, or encouraging and joining in activity. Weight loss surgery is a tool for weight loss. It does not fix everything. You will have received a video link of a past surgery patient talking about her experiences. Please take time to watch this. Our key messages are: weight loss surgery does not guarantee weight will not return in the long term. Successful weight loss surgery involves a lifelong commitment to lifestyle change. Following the liver shrinkage diet before surgery and the texture modifications afterwards are vital. Regular physical activity before and after surgery will improve skin tone, muscle mass, and maintain lost weight. Please note, if your weight increases during the wait to see a surgery provider, this may delay your surgery, so it's important to carry on with your lifestyle changes. Please make a note of any questions you have. You can send them in with your form confirming you have watched this presentation, or save them for your appointment to discuss this presentation. Please make sure you return your form. Thank you for watching this webinar.